Welcome to the Dental Marketing Guy Show. I'm Justin, the Dental Marketing Guy, and I am joined by none other than Katrina M. Sanders, RDH, aka the Dental WINEgenist. And Katrina is a rising star in the dental field. I met you over at Smiles at Sea at the first one. You've, of course, gone back since and made the finals both times, something that I don't know if anyone's ever done that. But certainly what you're talking about is resonating with not just hygienists, but all dental professionals. And what I'd like to just talk to you a little bit about kind of your philosophy and the message that you have, and really what is it that is getting people so attracted to what you're talking about. You've attracted so many speaking events for yourself, self-sponsored initially. Now people are banging down your door being like, well, come speak for us. And I'd like to get into some of those topics that you're most passionate about. But first of all, how are you doing?
I'm so good. Thank you. It's so fun to see you. I feel like when us Smiles at Sea people get back together, it's kind of like this fun little reunion. So good to see you, Justin. I'm fantastic. I don't know if have you been on a cruise before?
Actually, no. The Smiles at Sea that I went at was on land. It was there on the shore, right?
Okay. So the one that I did, we did an on-land version, and then we got on a cruise ship, and we did the same thing again on the cruise ship. And I forgot that my equilibrium kind of goes when you're on a big ship like that, and then you get onto solid land for the next like 5 days, you're kind of, wobbling everywhere. So I'm just now getting my equilibrium back from being back from Smiles at Sea. And it was a fantastic experience. Again, as you know, Elijah's amazing, and Jamie Amos is so fantastic. And they had a guest judge, Dr. Paul Homily, who's wonderful, just a fantastic doctor, speaker, and human being. So I'm great. I'm just on cloud nine right now from being around so many inspiring and amazing people. So, and thank you so much for having me on tonight. I'm excited to chat with you.
Yeah, my pleasure. The reason why I wanted to have you on is because, we talk about a lot of marketing topics, and it's like, well, what does this have to do with marketing? You've got a lot of interesting messages for hygienists, and hygienists are in the trenches. They're doing the work. They usually aren't super interested in, oh my goodness, how am I going to get new patients into this practice? But what really attracted me to your message is you mentioned something on Howard Farran's podcast about just, for patients that don't necessarily have the same clinical views as the real clinician. So for instance, mercury, amalgams, things of that sort, where patients are demanding something that, as a clinician, that it's a little hippy dippy, it's not necessarily right in the clinical way. But you said something that really made me go, wow, this is a different message. And that is, after, all these years of reading on Dental Town and the Dental Hacks Facebook posts and all that about dentists, basically like, hey, these patients are crazy. What you said is, why don't we just give them what they want, and why don't we just show them their options, and why don't we just educate them as to why we have this certain position, but be agreeable. And I'm like, wow, that's actually kind of different, because you have dentists who, it seems like a lot of patients, why they don't go to the dentist, in my experience, is they are afraid of being judged. And they're afraid of being kind of talked down to, like, why haven't you been flossing? And so these are a lot of different topics, but they're all sort of surrounding the same idea. And that is, being kind of open-minded and being educational and being, agreeable as a clinician. And you spoke to that on that podcast. So I was hoping you might be able to kind of get a little bit, what was there kind of a moment where you had this aha moment where you realized, hey, there's a better way to do this?
Mm-hmm. Yeah. Thank you so much. And thank you for your kind words. I did have a moment, and it was actually maybe 3 months ago. I was working in private practice, and I had the typical 17-year-old young man in my chair, and mom's sitting in the corner. She's on her phone and she's like, tell him he needs to floss, and doing the whole thing, And as a hygienist, we're so type A. We're used to walking in a room and I'm going to take the next hour I have with you to educate you on this. And you need to be doing this. And are you doing this? And are you doing that? And, of course, being an educator at heart, I have my master's in education. So there's that thing coursing through my blood that just forces me to have a responsibility to my patients when it comes to that. So normally I walk in the operatory like every other hygienist in the country, hello, I'm Katrina. Let's talk about your gums. How are you flossing? Do you notice bleeding? And there was something different about that day. I don't know if it was, the extra cup of coffee I had or what it was, but I just looked right at my 17-year-old patient, and I had done his gum exam and I started scaling. He's bleeding everywhere. And I just looked right at him and I'm like, are you flossing? And he's like, no. And I just looked right at him and I said, all right, that's cool. So if you're not going to floss, what are we going to do about this? And he just stopped and looked at me, and I just stopped and looked at him, and it was like, we're going to have this conversation. So you're not going to floss. That's cool. Like, I'm not going to tell you to floss if you're not going to floss. But what are we going to do? And you could tell this was so different. He had never had a conversation with a hygienist like that before. And for me, it was so important because the Associated Press released an article. This was in 2015, I believe, 2015 or 16. They released an article saying flossing is only recommended for a small percentage of our patient population. And that patient population is the 1% of our patients who have absolutely no bone loss and are excellent in their home care. That's literally one, not even. If you think about that in your private practices, there are probably 2 patients in your practice who have absolutely no bone loss and excellent home care. And those 2 patients are your hygienist and the dentist, or the assistants in the practice. You know what I mean? The majority of our patient clientele have bone loss or are non-compliant with home care. And every textbook that we read from when we're in dental school or dental hygiene school tells us those are not patients who are excellent candidates for flossing, period. But we've gotten into this weird habit where we just keep telling our patients to floss. You need to floss. You need to floss. So I just took a different approach with this guy. And I just said, listen, if you're not going to floss, what are we going to do? And I said, here's what I'm going to do. I'm going to list off some options of some ways to get something in between your teeth because, dude, look at this, and I showed him, all of the bloody gauze I had. And I said, this is just, you recognize this is bad, right? And he's like, yeah, I get that. I said, well, we got to do something about it. So I'm going to list off some options. I'm going to show you some things. I want you to tell me if this isn't going to work, I'm not going to send you home with this. Why would I send you home with that? If it's not going to work, then we're going to put it back. But we got to find something that's going to work. And by the end of it, I'd shown him a water pick, and he's like, you know what, I could totally do this. And the mom in the corner, on her phone just kind of puts her phone down like, what? And I said, Mom, is this something that you'd be interested in, making a purchase for him? This is a gadget that he'd be able to use and things like that. And of course she did the mom thing, well, are you actually going to use it? And he's like, yeah, I could really see men love gadgets. They love those things, So he's like, yeah, I could totally see myself using something like that. And it was in that moment that I realized I just took a different approach with him. And I could have sat and talked to him until, the cows came home about flossing. Because that's what we do in the dental industry. It's what we like to do. It's what we know. It's what we're comfortable with. And I thought, I'm going to try and be like the cool hygienist for once. That's cool. You don't want to floss, whatever. And it was incredibly effective. It was awesome. And the mother was so grateful because I had reached him in a different way. And that for me, that's when I started to think about the things that we get in the habit of doing as providers that we need to take a step back and kind of look at our role as healthcare providers. So another great example that you'd brought up earlier is fluoride. A lot of patients are anti-fluoride. And
Right.
for whatever reason, as dental providers, we take some weird personal offense to it. We see that in the clinical note, patient, no fluoride, mom says no fluoride. And it's weird. We get really offended and upset. And I think it comes from a place of us feeling like the mom thinks that they know more about fluoride than we do. But the reality is, I did a continuing education course, a self-sponsored CE course called What the Fluoride, and we cracked open all of these ideas about water fluoridation and is fluoride linked to thyroid cancer? Is fluoride use linked to Alzheimer's? And we cracked open these studies, and by the end of it, I had a room full of hygienists. I was going to say eating out of my hand, but not really. They were drinking the wine that I was offering them, but they were also totally moved by the fact that, holy cow, like there is some indefinite research here. And if I'm a mother and I really care about my kids, am I a bad mom for saying no to fluoride when there are other excellent remineralization opportunities for these patients? So then I need to take a step back and go, it's not my job as a healthcare provider to change my patients' opinions. It's simply my job to provide the information and to provide recommendations. And if fluoride doesn't work for that patient, something else will.
This is actually my kindergarten citizenship award.
No,
yeah, I don't have a college degree.
I don't either. I just have participation trophies because I'm a millennial, so I just had all of those. It's great.
Yeah. I even when I win first place, I always make sure to grab the 8th place trophy because I deserve it. I'm entitled to it.
Absolutely. We're all about entitlement.
Yes. They owe it to us. So that's really interesting. Now, what about perhaps say like mercury or amalgam or things of that sort? I don't know if that's something that you get into as a hygienist, but I know some of the dentists, it's basically the principle is don't be so dang judgmental. Try to help, be a little bit empathetic, right?
Yeah. Yeah, and you bring up a great point about amalgam because mercury is interesting. The same people who are concerned about amalgams are the same people who are going out for happy hour and enjoying sushi and exposing themselves to mercury.
That's me. I won't. It's all composite with sashimi.
Right. Yes, I love sashimi. So, you have to think about it because when I get my anti-fluoride patients, I ask them, do you drink tea? Well, fluoride is naturally occurring in tea. So we need to think about where this line is when it comes to our patient's belief. And we tend to get this idea, this perception in our minds about patients who are anti-fluoride, anti-mercury. We get this idea that they are, your granola, hippie, nothing that's synthetic. And I would say 90% of your patients aren't like that at all. They've read an article, they've read something on social media, they've had a friend tell them, those silver fillings are really bad for you. They don't realize when they have mercury fillings in their mouth, which a lot of them do, they come to the dentist because they want to have those mercury fillings removed, right? They don't realize that every single time they chew, they're releasing mercury. And they don't realize that they're exposing themselves and the dental practice to higher or a greater concern of mercury by having those mercury fillings removed all at once. In fact, OSHA and the CDC are now working on amalgam screens that are going to need to be placed into our traps, our suction traps, because of the concern about environmental mercury being, repositioned back into the environment. So, and of course, who's going to sit down with a patient and explain all of this? You don't have time in your day as a dental provider to explain all of this. At the same time, it's important because a lot of times you're getting these questions from parents about their kids. And is amalgam an excellent option for a pediatric tooth? Absolutely. Because these kids are moving around, you're working in a wet field. Composite's not an option for a lot of young pediatric patients. So I think as a dental provider, taking the opportunity to share the benefits of the recommendations that we have and listening to them. I started my fluoride talk with an example. This was a patient that I had in private practice. Let's call her Marianne. It was my first time meeting Marianne. I had stepped in as a hygienist in the practice. And in fact, before I even treated Marianne, She needed a phone call from me for me to share my credentials with her. She wanted to know that I was qualified as a hygienist to clean her teeth before she came in for her 6-month checkup and cleaning. So of course I explained to her I have a bachelor's degree from the University of Minnesota. I'm published, da 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 da. She's like, oh, I suppose you'll do. So Marianne comes in her chart, she's got in big bold letters, no fluoride, x-rays every 2 years, that typical, what we call a pain in the butt patient. And, right out the gate, it's like, oh, this is going to be fun. So I bring Marianne back. I start doing her gum exam. Of course, she's sensitive because she's got these receded gums. So she's got exposed roots. And so she's sensitive during the cleaning. And I'm talking to her. I didn't once mention fluoride. I saw that in her chart. I didn't mention it once. I just said, Marianne, I'm concerned because you have these exposed roots. And all I did while I'm scaling is talk to her about what these exposed roots mean. And I said, these roots don't have the strong minerals like we do with our enamel. These minerals really help to prevent not only against sensitivity, but cavities. And I'm going on and on and on. And so she literally, I'm finished scaling her. She looks right at me and she goes, so is there some kind of like a mask that I can put on my teeth that embeds minerals onto them? And I said, yes, there is. And she's like, can I get that today? And I said, absolutely. It's called a varnish. It has fluoride and calcium minerals in it. And she was like, oh, but it'll strengthen my teeth. And I said, yes. And from that moment forward, I was the hygienist who sold a fluoride varnish to Marianne. And she was that patient in the practice that was just so against everything. I didn't once mention what it was. I just addressed her problem. And if Marianne would have said no to the fluoride, could I have said xylitol is a great remineralizer or Recaldent will help? Could I have provided her with other options? Absolutely. Absolutely. But that's a nice, little notch in my belt, to say, hey, listen, I sold fluoride varnish to Marianne, the pain in the butt patient. So I think it comes down to just having those conversations with the patient and using those taboo words and kind of throwing them out for a quick moment and just talking to them about what their needs are, not making it about, I'm going to be defensive of fluoride today, but I'm going to customize this conversation to you, Marianne.
Yeah. And what's funny is what you're doing is you're not talking about the product. You're talking about the benefits of the product. So clearly when this person had heard of fluoride at some point in the past, her thought was, oh my goodness, there's all these dangers, there's all these drawbacks. But no one actually took the time to explain what, in her particular case, fluoride could do for her. And so, sales is a 4-letter word in dentistry. We're not supposed to say sales. But if there was ever a case of sales being clinically valid, it would be what you just described right there. Wow. How are you supposed to treat someone without their consent? Mm-hmm. You have to convince them that whatever product you have isn't about what CBCT or CEREC or whatever gadget or gizmo you're trying to push on people, but talk about the benefits. Talk about what does it mean to them. And that's really interesting because I like that story because you're being, it's almost a little bit tongue in cheek where you're like, I'm not going to say that word because you knew, but that kind of goes back to kind of knowing the patient. And that was in the practice management system, right? Right. So you had those notes. So that's kind of an interesting note right there, is that someone had the presence of mind to get to know this patient, but no one ever thought, hey, let's take this data and let's take this type of patient. We know who they are, and now we see what they need. What if we combine those two things? So we don't mention fluoride, but we do mention their particular case. Right. And then in the end, you didn't swindle her. You did say it's fluoride.
Oh, absolutely. Yeah, I would never, give somebody, because at that level, fluoride is considered a drug. I would never give a drug to somebody without their consent. And she fully new. But you bring up an interesting point, Justin, and that is that a lot of times when patients come in and it automatically says on their chart, no fluoride, or, whatever, so often I feel like dental providers check out. You know what I mean? I'm not going to talk about fluoride. It says no fluoride. I'm not even going to have a conversation about remineralization. I'm not going to have a conversation about caries risk. You just stop the conversation there. And we were talking a little bit earlier before we hit record about branding and things like that. And my brand absolutely is kind of the contrarian. I'm always going to push the envelope. If you were to ask my boyfriend, he'd tell you I do. I always try to push it a little bit. I accept a challenge when a patient comes in and they're anti-fluoride. Let's talk about that, whereas other providers may say, I'm not going to take the time for this, or I don't want to get into an uncomfortable or awkward conversation. And I think that's the main concern that a lot of providers have. That's an uncomfortable conversation. Now you're asking somebody about their beliefs. And we all know, when you get the family together, around the dinner table, you don't talk about politics and you don't talk about religion, you don't talk about your beliefs. And now we're creating these conversations with patients where we're asking them their beliefs. But in my experience, 9 times out of 10, those beliefs are based on things that they've heard or they've read. And who really is the expert on dentistry?
And I think that's actually another point, is when you're talking about marketing and patient attraction, a lot of it comes down to authority. So if you're not viewed as an expert, then a lot of times, and I know this is the case with me, I was just having a conversation with some of my best clients. I'm like, what's great about this relationship is I can get you the best results because you trust my recommendation. And when you trust my recommendation, I can do so much more. When you're not worried about me skipping down to the next dental office down the street, so we're able to, publicize your practice, and, I can be in the mix there. And the idea is, if your patients go in begrudgingly, and they're barely sold on you even having a certificate, not like this fake certificate right here. This is not a real dental degree. If anyone's wondering, I'm not a dentist. That is not a dental degree. But they're like barely. They're like, well, he's a dentist. It's like the person that you said, like, well, you'll do. You've been published in all these articles. You'll do. But yeah, if you don't have that trust, if you don't display somehow, in this case, you did it chairside, which is remarkable. And I think that's probably the best time to do your best. I hate to use the word marketing or sales, but that really is kind of where the best relationship building is done. And that's where people are going to trust you the most. They're already there. Right. So just getting them in the chair is like 90% of the heavy lifting, especially when you have to pick them up, fireman's carry.
Yeah, they're too much, Yeah.
Yeah. You take the back out, you got to buy these expensive loops and everything.
I know.
So, yeah. But the thing is what you're describing is you were able to describe what the problem was for this person. And you didn't attack her beliefs in that way. So this is really interesting. I think we've talked on this enough. I think, our viewers get that the message that you're portraying, I think, is very much needed in dentistry. Tell us a little bit about your upcoming events, some of the topics you have, and where did this title, The WINEgenist, come from? Tell me about that.
Oh my gosh. Yeah. So I've had all these like really crazy, awesome, amazing things come my way. And I would say the first thing that has really been amazing and life-changing for me is my board preparatory course. I have a dental hygiene board prep course where I bring dental hygiene students in. We have a 3-day intensive weekend where my faculty and I review the majority of the content that you'll need to know for your in order to be successful on the national boards for dental hygiene. I just had my spring offering about 2-3 weeks ago. Oversold the course. It was fantastic. It was amazing. And actually, I have had a couple of participants who have since taken their boards and have already found out that they've passed, which is amazing. Back in the day, I'm going to say back in the day, because I've been practicing long enough where I can say back in the day. Back in the day when I took my boards, you had to wait 6 to 8 weeks in order to get your results. These kids get it in like a week and a half. It's amazing. So that's my dental hygiene board prep course. The dental WINEgenist is my my persona when I do my self-sponsored coursework. So I proudly received my level 1 sommelier early this year in January. Sommelier is a wine expert as recognized by the Court of Master Sommeliers, which is an international court. And it involves blind tastings and didactic exams and knowing different wine regions and all this fabulousness. So I'm very passionate about wine, and I'm very passionate about dental hygiene. And so I found an amazing way to take my love of both and combine them. During my self-sponsored courses, I deliver fluoride wine flights during my coursework, where I educate my participants on whatever types of wine that they happen to be drinking. My brand is a bit provocative and a bit contrarian, or the consilience. I definitely try to push the envelope on topics in dentistry. You know, a lot of dental hygienists and dentists say the same thing. You know, if I have to go to another CE course that talks about probing or that talks about this, I'm going to lose my mind. We're starting to get really repetitive in continuing education. And I love being able to take these really provocative or unique topics and deliver them in really special and meaningful ways. My goal, my message, my why is to inspire and empower. I think as dental professionals, we go into the operatory day after day, and we utilize these beautiful skills that we've developed in school. And then we get burnt out by patients who maybe don't believe in our care or don't listen to what we have to say. We work with coworkers who are, half in, half out. We get so burnt out. And so if we can come together during continuing education and reignite that joy and that passion that we have for the good work that we're called and compelled to do in dentistry, and have fun doing it and network, and maybe go back to clinical practice with some unique ideas about what it is that we do when we care for our patients. If we can do those things, then I have done my job. So, my goal is to find special ways to reach people. I talked about my fluoride talk. So going over some of the really specific research articles, some of the things that the ADA is saying about fluoride, what are some other options for fluoride. One thing I'm really excited about, my sister is a podiatric surgeon. And so she treats a lot of diabetic patients. And we know dental hygienists treat a lot of diabetes from the other end. So she and I are working together on a symposium to bring, to put your foot in your mouth, basically. See what I did there? Did I?
Yeah, that's
I'm punny.
Smiles at sea status. You're like moving up in the world, because you did the comedy thing last time.
I did. I'm so embarrassed that I did it, but I had to do it because, I had to be brave and just do it. I feel like there's nothing more terrifying than being a stand-up. Well, there are two things I'm absolutely petrified of. The first is being a stand-up comedian. The second is the deep sea blue, like being those documentaries about the Titanic, when they like go down and it's like pitch black and there are these like whales and they've got like this giant spotlight on the ruins of the Titanic. I get physically sick. It freaks me out. So when I went to Smiles at Sea, I did a stand-up comedy routine and I went snorkeling.
That's impressive. Well, what's even more intimidating is Carlos Rodriguez. You had to do it in front of him, the king of dental comedy. What do they call him? The malegenist, the mangenist?
WINEgenist. He's a
The
guy
guy
genist.
Dennis. Yeah.
Yes, yes.
He's man, that guy's so funny. It must be really hard to come up with material for dentistry though, because it's like when I first heard him speaking, it was like doing his comedy. I was like cracking up so bad, and I'm like, he can't possibly come up with more. And then like he came up with more. It was like, wow, that guy's hilarious. So you did? Was he there at the event?
He was there. Well, yeah. I had two major goals while I was there. I wanted to get a picture with Paul Homily, which I did. And then I wanted to have Carlos ask me to be his opening act. Those are my two goals. Carlos hasn't asked me yet, but I think he's just trying to find a unique way to do it. You know what I mean? Like, I don't know, a flash mob, like in my front yard or something. I don't know. I think he's working on it. But yeah, he was there. And you know, he actually performed on the ship. And it was nice to see him perform on the ship because he was definitely censored. You know, when you're broadcast live and, you know, like your 12-year-old can log in and watch. But on the ship, he was totally uncensored. And he was, I mean, people were literally like holding in their pee, crying. He's hysterical. He really is, because he brings a different idea to dentistry. You have to laugh. You do, because some days you're just dealing with such ridiculous things. You know, you're like, this is my job. This is what I, you know, went to school. I have a doctorate in this, and this is what I'm doing, you know? So he brings a really great message. And I admire him so much because it was terrifying being up there and doing that. So kudos to my friend Carlos Rodriguez. He's amazing. He's wonderful.
Yeah, I got to get him on the show because he's really something. He's quite a talent. Okay, so cool. This is all really interesting. I think it's kind of eye-opening because, as you know, when I talk about marketing, I talk about how do you attract patients, but it's really nice to hear like what you can do to really enhance the patient care through really just being real with people and being open with them. And like you said, giving scientific evidence, you know, like here's the studies on this, if they're ready for it, right? So you don't try and ram it down their throat. Don't get, and so I guess if there's one thing that dentists and dental hygienists can take away, it's just that, you know, we might all have fluoride in some level in our bodies as part of the compounds that make us up, but you don't have to pretend like someone's insulting you because they don't want fluoride or amalgam or same-day crown or whatever the case may be.
And you bring up an interesting point from the marketing side of it, which, you know, as hygienists, we don't want to talk about marketing ever. But you bring up an interesting point, and that is getting patients in the chair. So I would bet, and this is just a number I'm going to pull out of thin air. You probably know the real number, so please interrupt me if you know the real number. But I would bet that a lot of times when you get a new patient in the chair, probably 75% of the time that new patient has arrived at that office based on some kind of a referral.
It seems like, yes, but it seems like a lot of it is word of thumb now more than word of mouth, as much as word of mouth. So yeah, the reviews, the online reviews, yeah.
Word of thumb, I like that. So one of the practices that I work with, the average is about 90% of new patients are referred by an existing patient within the practice. So what that means is every time that you sit down with a patient, that patient is a referral source for their entire network. And this is not news to you, right? You teach this all the time in your coursework. But what's interesting to me is that I think we need to go back to what's the patient experience? I you know, and I'm not going to toot my own horn, but I'm really good at scaling teeth. I am. I'm really good at scaling teeth. I'm good at polishing teeth. I've been doing it for years. I was faculty. I taught it. I made rubrics on it. I did examinations on it. I can scale teeth. But to sit down and actually have a human experience, there's a reason why computers will never be able to replace what I do. And that's because I do provide that patient experience. I sit down. It's not, well, let me give you a bunch of facts about fluoride. It's, let's talk about how I can provide services that will enhance your oral health.
Right.
And that's a different conversation. And I think as a provider, it's important for us to know that. Going back to Marianne trusted me implicitly after that. Whatever I suggest, it didn't matter. If the doctor wanted to do a crown, she didn't believe it from the doctor. I had to be the one to say, Marianne, you need to do this crown. And she'd say, well, if you say I need to do it, then I'll do it. Marianne trusted me. Marianne trusted me because I had that conversation with her. And Marianne referred her family. For a long time, we hadn't seen her husband. He had kind of fallen off the wagon, as a lot of patients do. Her husband came in and started seeing me. You know, there's trust that's built. And that trust, sometimes we think by hanging our fake certificates on the back wall like you have there, Justin, sometimes we think that by, hanging our credentials or having alphabet soup after our name, that all of those things instill trust. And a lot of times for patients, they think that just means that you're so overeducated that you lack an ability to reach them as humans.
Like, my dentist, he's one of those fagdas, right? There's a lot of fagdas around,
Oh, okay.
My cousin's a fagda too. He's not even a dentist, but
AGD is what you're saying. I was like,
but patients don't know what that means. That's kind of where the joke is. They don't know what that means. They're just like, oh, my brother's friend is a fagda too. I've heard of those. There's a lot of them in Hollywood.
Yeah, lots of them in Hollywood. Lots of them in San Francisco.
and so DMD, DDS, does it make a difference? Who knows? But the point is I'm talking about patient perception, of course, not clinically. But it's a really good point that you bring up. And so, yeah, I mean that's the thing, is all the letters after the name. It's really just what you did for her. It wasn't the fact that you taught other hygienists how to pass their boards. She wouldn't even be receptive to that message until you solved her problem. And like you said, now she trusts you over the dentist, which is a very serious problem for the dentists that are watching this show. We think that is a very bad thing.
Every dentist who's watching this knows that there are patients. This is what happens. The doctor says, this is what you need. The doctor takes off their gloves, leaves the operatory. And what does the patient do? The patient turns to the hygienist and goes, so do I need that? Should I really do it? And then it's up to your hygienist to say, yeah, Bob, you got to get this done.
Yeah. Because it's a peer. It's considered, I mean, I think people think dentists make a lot more money than they actually make.
Oh, when patients say, oh, I'm just, paying for his yacht or whatever, it honestly makes me so mad. And, I don't know if you can tell, I'm a natural ginger. So you don't want to get us mad, because we can go off the deep end. We can go a little bit too far. But that really frustrates me. And I rarely speak up with patients, but when patients say that, I do spit back with, you realize that the doctor is constantly updating the equipment in this office and supporting me in continuing education and getting new credentialing and paying back their students. Like you do realize that this is a thriving healthcare industry for you. And they shut up right away. They're like, oh, probably because I'm a ginger and they don't want to get into it with me. But
they're like, she can throw a left hook. I can tell. I can tell by the way. I can tell by her stance. When she shook my hand, she was all boom.
That's right. They're watching out for me.
So Katrina M. Sanders, RDH.com. You can check out the calendar link for upcoming events. As of the time of this airing, you've got some stuff going on, looks like in Southern Arizona. Plenty more to come. So thank you, Miss Sanders, for coming on the show.
Oh my gosh, it was my pleasure. Thank you so much, Justin, for having me. It was a blast.
And if you guys have any questions for Katrina, feel free to reach out in the comments below. And thanks for watching the Dental Marketing Guy show.